And ladies, our first guest is just for you, especially if you're dealing with vaginal health issues. Check this out. The Femilift laser is a 15-minute treatment. Dr. Deborah Tozer is very excited about the new advancements with the Femilift laser, and she joins us with more. Nice to see you.
Yes, nice to see you.
I'm so glad you're on the show because sometimes it's embarrassing to talk about certain issues, but that's why we just put it all out there on the plate so everyone knows exactly what we're doing here today. Before we get to the Femilift laser, let's talk about what happens to a woman's vaginal health over time.
Yeah, the vaginal tissues are very much like other tissues in the body. The skin, for example, over time it naturally is going to lose its strength, its elasticity, it becomes very frail. And there are many things that can contribute to that over life. Heavy lifting, straining, pregnancy, and menopause. The lack of estrogen that we lose during that menopause time weakens that tissue and makes it very thin and fragile.
Right, and that's why your doctor always says, do Kegels, do Kegels.
That's right.
But unfortunately, sometimes that doesn't work.
That is very true,
and women don't listen. So that's where the Femilift can come in. What can it do?
What the Femilift is designed to do is actually reverse those changes that happen over time.
Okay, we have a before and after photo that we're going to show you here, and explain what we're seeing with the pre-treatment photo right here.
I think actually that's the post-treatment.
Is that the post-treatment?
Yeah, it is. That's
all right.
Okay, but that's a good way to look at things. That's what tissue should look like. It's very thick along the top layer, the surface layer. You've got a lot of organization, a lot of grooves in the underlayer, and that's what the tissue should look like.
Okay, so
that's our goal.
That's the goal.
That's the goal.
A healthy vaginal wall, right?
Vaginal wall.
Okay, so let's go to the next one.
And this is actually, I think, a great way to actually look at things is now to see the weaker tissue. So this
Right.
is what happens to the tissue over time. As you can see, that top layer is much thinner. There's less organization. It's more friable looking. The difference is mainly, as you can see, is the thickness of the two layers. The after treatment, we want that nice thick upper layer, more organization in the collagen, which is what gives us that strength in the tissues.
And who would you say is a good candidate for the Femilift laser?
That's the great thing about the treatment and the laser therapy. Many women who may not qualify for other treatments would qualify for this laser. It can be done at any age, at any time in their life, depending on their needs and the indication for the procedure.
And what's the process for the procedure?
The process actually is very simple. Initially, we want to do an interview, make sure we know what the needs are, what areas we need to treat. We want to make sure our health screening is up to date. And then once we are satisfied with that, we're able to move to the procedure itself. It's very simple. It's a 15-minute procedure done in the office.
Oh, wow, that's quick.
It's very quick. It's done, we have the patient laying down. A small, very slender probe is used, very similar to an obstetrical ultrasound done early in pregnancy, so that same kind of pressure feeling that you might have. We then give a little test dose to make sure that it's tolerated, and surprisingly there's very little nerves in the upper aspect of the vagina, so people tolerate it very well.
So it doesn't hurt.
It does not hurt.
Now, what's different about this laser, the Femilift, compared to others out there on the market?
It has a lot of unique features. Most importantly, I find, is that it's available to OBGYNs exclusively. So it's in the hands of individuals who treat these symptoms on a regular basis and are trained to do laser type therapy. It also is different in that we can focus the treatment into the area of the problem. So instead of just giving a very broad treatment to the entire area, but we do have the ability to do multiple areas at the same time. It depends, again, on the patient's needs.
Well, there's a video that helps us out.
Yes, and it's a great video that kind of shows then how that works to rebuild that collagen under specifically the bladder. So that's the probe. It can rotate in a 360 degree, again, so we can focus on the area that we're looking for. This is showing how the fractional CO2 laser penetrates into the tissue, into the dermal layer. It has a thermal effect and also an ablative effect, so it kind of spreads, and that works for rebuilding that collagen. And it's a simple 15-minute procedure. We do recommend, for maximal benefit, to have 3 of those treatments.
Okay.
However, even after 1 treatment, you can definitely start seeing that improvement. And you don't have to be afraid. You don't have to not be able to exercise to laugh anymore.
Yeah. Live your life, enjoy it.
Exactly.
And before we close, what's the recovery time?
That's the additional beauty of it. After a treatment, you can go back to your regular routine right away. You can go back to work. You can go back to exercise. There is no downtime. There's minimal restrictions for a 3-day of what we'd call pelvic rest. But outside of that, you're good to go.
On your lunch hour, you can go
On
have
your
it
lunch
done and go
hour.
back to work. I can
Yes.
laugh again.